We've had the 6 phone lines ringing, we've got extra staff in, we're absolutely packed, we've got people in the waiting room out in the lift since 7 o'clock this morning, and we're absolutely overwhelmed with the fabulous support that we've had.
I have been having treatment for bowel cancer, and I've been told there's nothing more that can be done, so just come with the hope that maybe I can get some treatment.
He's 3.5. He's got a brain tumour and disease in the spine as well.
My son Sean's 19 and has had a cyst on his lung, and it's turned out to be quite severe, rare cancer. So we'll give him any hope that we can have.
And outside there is absolutely packed.
I have only sufficient equipment to treat about 12 patients a day at the absolute maximum. Well, I'm afraid we should have to tell them all to go away because we just can't cope with them, let alone take anybody else on.
I mean, we were told about Dr. Holt about 18 months ago when my son was diagnosed, and you get bombarded with a lot of information and things, and you just don't know where to turn half the time.
I'd heard about it about 7 or 8 years ago when a friend in England had actually rung me. His wife was very ill, and we asked a couple of doctor friends, and they said, no, not worth trying.
Pretty angry, especially if it's worked, if it's been something that's been an effective treatment. Yeah.
People's ignorance is fascinating, but the more knowledge you get, the greater ignorance can become.
The phone's going non-stop at home until almost midnight. And today it's been colossal. They've even invaded my son's surgery because he's the same name as myself and they think it's the same firm. But it's not. It's been enormous, and I'm trying to sort through all the faxes that have come while my staff interview all the people who've come.
I really hope that what comes out of this is the support that Dr. Holt deserves, absolutely, and that perhaps there's some hope that we're not going to lose this terrific therapy in the future. That's my biggest concern.
When will you retire?
Oh, I don't know, sometime in the future.
And what happens then? Your system, the procedure just goes into history?
I was very lucky in that a general practitioner needed my services who was out working up in north or west Australia some years ago. So he went back to Ireland and he's opening up a clinic there now, which I'm setting up and doing for him. So there'll be a clinic somewhere in Ireland.
So once you stop, presumably we'll have to fly to Ireland to get...
You can all go to Dublin, yes.
It's a sad thought, isn't it? His sons, incidentally, are orthopaedic surgeons, not cancer surgeons. So after that overwhelming response, where does the medical profession stand now on Dr. Holt and on his treatment? The president of the Australian Medical Association is Dr. Bill Glasson, and he joins us now from Brisbane. Dr. Glasson, thanks for your time. There are hundreds of people today lined up around Dr. Holt's clinic in Perth. Our phones and emails have melted down. Do you think this bloke might have something?
Well, I think the reality is that a lot of these people are desperate, Ray. These people have gone through traditional medicine and they've often come to the end of the road where traditional medicine hasn't worked. And I suppose we need to turn to somebody who we feel that might provide the answer. He's an eminently qualified doctor. He has a huge respect of a vast number of the medical profession and a huge respect of a vast number of the community at large.
It's quite clear, though, Dr. Glasson, that he's not after fame, he's not after fortune in this thing. He says, I've been bashed up by the medicos and the scientific fraternity for 30 years. Go away.
You're right. He's not in for the money, you're absolutely right. And he's got a treatment that basically has, I understand, little side effects. It's a safe treatment. He's dealing with people that, as I said, are desperate. They're at the end of the road. They've been told that traditional medicine will not work. And so I think he's giving these people hope, Ray. If nothing else with patients who've got cancer, if you can give them hope, that's a very, very powerful tool.
But, you know, he says we've spent in the Western world hundreds of millions of dollars on cancer research without any great breakthroughs. He says, I think I can cure cancer. Why doesn't someone come and ask me?
Well, I think that's the challenge. If Dr. Holt feels he can cure cancer, and everyone as doctors, and certainly people listening to this program tonight, as doctors, if we could find a cure for cancer, you know, we would think we've solved, you know, most of things in medicine. So I think that every one of us as oncologists, as doctors in general, want to find the cure. We are desperate to find the cure. We want to help our patients. And if Dr. Holt feels as though he has the solution, then we need to actually listen to him, listen to the evidence that he puts forward, and look at appropriate trials that underpin, I suppose, the opinion that he has.
It's a bit like you're guilty until proven innocent. Why doesn't the AMA, why doesn't the government, why doesn't the Cancer Council come to him and say, look, you seem to have some fairly remarkable results, let's have a look at what you're doing, rather than wait for him to come to you?
Yeah, I think you're right, Ray, and I think probably out of the program last night and tonight that there'll be a lot of, I suppose, pressure on all groups to actually look at the data, look at what has been tried around the world, and look specifically at Dr. Holt's data, and see whether we need to put funds into the system to, you know, put proper scientific trials in place so that, as I said, we can support or prove one way or the other whether this treatment works or not.
Dr. Bill Glasson, I know that I've pulled you out of surgery. I appreciate your time. Thanks very much for your comments.
Thanks, Ray. Thanks very much indeed. Good evening.
And we'll keep pushing for some action on Dr. Holt and his treatment. We would love to hear of your own experience. Please drop me a note. Okay, to Dr. John Holt again. Over the last week or so, we've brought you the remarkable story of this highly qualified surgeon in Perth. He's been treating thousands of cancer patients for 30 years now, with astonishing success. The success stories have all been anecdotal because, apart from 2 questionable studies, the cancer and medical establishments in Australia have totally ignored Dr. Holt's treatments. 79-year-old Dr. Holt has never shown his controversial radio wave therapy to anyone before, except, of course, to his patients. Well, tonight, he's agreed to show us.
I've never seen anything like it in all the years I've been here. It's just unbelievable. We've had about 300 faxes overnight in just the 6 hours we've been away, and
huge
you know,
mail.
we've got mail sitting there that we just can't get to.
It's just after dawn in West Perth, but the world of cancer sufferers can't wait.
I'm exhausted. So am I. Good morning, Dr. John Holt's room.
There's another fax for you, Dawn.
Thank you. Okay, this is just in the last 6 or 8 hours.
It's a 3-week course of treatment that we do. And basically, in order to assess you, what we'll need you to do once you have a read of the information...
Nikki and Dawn, his nurse, have worked in Dr. John Holt's clinic for years. After our story last week, their lives have been turned upside down, with hundreds of patients lining up every day, thousands of phone calls, and an endless pile of emails, all asking for help.
Hello.
Yeah, hello.
Well, I've got a delivery of about 5,000 emails, and it's only half of what we've received. 90% of the emails are people who chemo can't work for anymore, and the medical profession have turned their backs on them, and they're looking for some kind of hope.
Desperate, sad?
Both. Horribly sad, horribly desperate.
6 years ago, Elvina Johnson had what her oncologist called a galaxy of tumours. She lost a leg and was given weeks to live. She credits Dr. Holt with saving her life. That's why today she runs the support group.
When I was diagnosed, I did all the chemo. I did the amputation, I did the chemo again, I did the lung operation, and then when I relapsed for the second time, there wasn't any hope for me. So then when I went to Dr. Holt, I got a new lease on life, I guess.
I wondered how you'd go.
Yeah.
Elvina has now been cured of a cancer, but she's back in Perth with her mother and a much-loved grandma. Granny has advanced breast cancer. She's never had chemo or any other treatment except Dr. Holt. This is her 3rd visit, and MRIs show that the cancer is getting smaller.
Look at me. I've just turned 89, and I discovered I had cancer of the breast.
Yeah, I know. I think that machine's very good for Mum's face. I'm going under.
Today, Dr. Holt is going to treat you for 8 minutes, 3 times each, okay? After the first 8 minutes, I'll stop and give you a little drink and a wet face wash if you need it. Okay? And are we ready to go?
Yes, thank you.
Okay.
Thanks, Shirley.
Is it a case of thousands?